Welcome to Collegial Conversations with Diana Clark, the professional webinar series that offers clinical and personal perspectives on issues that are common, but often not talked about. Here is today's Collegial Conversation.
Thank you for joining a Collegial Conversation with Diana Clark. Joining Diana today is Rachel Hubbard. Rachel is a licensed clinical social worker in private practice in Houston, Texas. She has over 10 years experience in the field, including community mental health, school social work, higher levels of care, and outpatient practice. Her specialties include eating disorders, OCD, trauma, anxiety, and life transitions. Her methodology includes somatic experiencing, acceptance and commitment therapy, emotionally focused family therapy, exposure response prevention therapy, and trauma and grief component therapy. Rachel is passionate about staying up to date on current research and meeting people where they are to find their best way forward. Today, Rachel and Diana will discuss emotionally focused family therapy, acceptance and commitment therapy, as well as explore somatic experiencing. Thank you for joining us today, Rachel, and I'm going to pass the conversation over to Diana.
Thank you, Alex, and welcome, Rachel. Appreciate you joining. So let's talk. I want to start with ACT because it actually fascinates me, and I know a little bit about it. I know it's in the cognitive behavioral therapy realm. How does it differ from CBT?
Yeah, I'm glad we're starting here. ACT is one of my favorites. And actually, I usually would say that ACT picks up where CBT leaves off, I think. So CBT is all about challenging your thoughts, kind of different ways of coming up with evidence or methods for
disputing our thinking,
disputing your thinking, recognizing when you're having just a distorted thought that's not accurate. And so CBT tries to have you challenge it. And there are some scenarios where that works great. And then there are some scenarios where it actually can get you sort of just caught up in a web where
I can imagine the inner dialogue.
Yeah.
That's a false narrative. No, actually, it's not, because look at this, and this. I can imagine it reinforcing a narrative to try and challenge it that way.
Yeah, 100%. And so when that's happening, I think that's where ACT or ACT comes in really beautifully, because it is more of an acceptance-based approach about just not giving your thoughts really any power at all. And just saying that, like, one of the metaphors is that our brains are just thought machines that are just kind of putting out thoughts. And it really, rather than the CBT version of true versus not true, ACT does helpful versus not helpful. So basically, you kind of totally drop the rope on true or not and just say, do I need this thought? And if I don't, I'm just going to accept that it's here and then wait for it to go away. So that's the mindfulness component.
I love that. So let me tease that out just a little bit further. I always think, when I'm thinking about challenging narratives, or when I think about moving beyond a perception, I'm always thinking about that story of the two wolves, right? The brave says to the elder, "Grandfather, I've got two wolves in my head, one that is mean and angry and jealous," or what we could call a distorted thought, and one that is kind and generous and loving, which we could call maybe a productive thought. And the brave says to the elder, "I want to know which wolf lives." And the elder pauses, because all wise elders pause, and says, "The one you feed." And that would seem true for a lot of what you're talking about with it's what thoughts you choose to pay attention to, right?
Yeah. Oh my gosh, I love that. Yes. And so what ACT would say is that, first start with acceptance that other wolf, that those two wolves that are in there are totally normal. They're part of being a human. They join you with the human race. They don't, that just because maybe the negative wolf is louder, it doesn't actually mean it's any more helpful than the other one. It doesn't mean anything bad about you because you're having it there or you're hearing it. So it starts with a lot of acceptance, and then saying, the way to kind of feed the wolf that you choose, or the wolf that that you want to choose is to one of the questions is, okay, what's helpful and not helpful, but also not to try to even really do much with the other wolf, to just sort of say, okay, well, you can talk.
Pat the wolf.
Yeah, you can howl. It's all okay. I don't actually have to do anything. That howling doesn't have any power over me. Um, one of the it's I love that you brought up this story of the wolves because the act actually loves metaphors. If you buy a book on this, there's
Is that
metaphors.
right? That would be one. Yeah.
Yeah, and there's one that they use called Passengers on a Bus that kind of that helps you figure out how you can see yourself as the driver of the bus and all of your thoughts and urges as just passengers on the bus. So they can annoy you, they can distract you, they can be distressing.
Right? But you're still driving.
Yeah.
But you're still driving. That's a great metaphor.
Yeah.
Yeah. I always have these images of my dog, my thoughts, the thoughts that are more like wolves, as little dogs that nip at my heels. And I can choose to turn around and pet them, but they're always going to be there nipping at my heels.
Yeah. Yeah. I love that you bring up the turning around and pet them piece because I think sometimes that's the piece we skip. We kind of go straight to like, oh, I don't want these thoughts. I don't want to listen to them. And actually, the petting them piece helps because it takes us out of this like fighting zone into a more acceptance and even sometimes gratitude. Like, thank you, brain, for doing what brains do. And yeah, I can just pet this puppy and I don't have to pick it up.
And it is just a puppy.
Yeah. Yeah.
It is just a puppy. If I turn around and I face that puppy, it stops being so big.
Mm,
The fear I'm fleeing. If I turn around, I see it as much smaller.
yeah. Yeah.
So I can see that. So let's move on in our alphabet soup conversation.
Okay. Okay.
EFFT, emotionally focused family therapy.
Yeah.
Tell me a little bit about that.
Okay, so emotionally focused family therapy really it's a take on family therapy that's a little bit different than the traditional model where you would have everyone in the family in the same room. And what this method does is you really just work with the parents. So this works really, really well for parents that are trying to figure out how to care for a child that is going through something hard. Yeah, it can work well for anything, all the way from just regular life hardships to things like eating disorders or OCD or just any struggles they might be happening. So it's I would say maybe its tagline is that it's emotional solutions for emotionally based problems. So it starts with the um the science of validation and how deep validation can help take your child or someone that you're caring about from their downstairs brain back to their upstairs brain so that then you can meet them with emotional and practical support. And I would say that's probably the most important component of it is really making sure step one is a deep validation.
So I'm going to back you up then.
Okay.
So step one is seeing your child.
Yes.
Right? Seeing the struggle, seeing the challenge, seeing the growth, seeing the progress, and then validating.
Yes. Yes. Seeing them, really truly empathizing, resisting the urge to kind of get pulled in any other direction, but having that moment of connection. Yes. Seeing them that what they're going through is hard rather than what their behavior is necessarily saying.
Right.
Yeah.
I like that. So let's move on to the next alphabet, somatic experiencing, SE. Tell me more about that. I've had some very interesting personal experiences, and I'd love to hear more about it when it's done well. Yeah.
Yeah. SE is something I've gotten into more recently than some of the others, just in the past couple of years, and I've been loving learning about it too. It is what they call a body first approach to therapy. So basically everything else we do in therapy is top down. We're working with the brain, we're working with
We're working the neck up.
yes, yes. And so SE, somatic experiencing, is trying to do whole body. And really it wants us to do body first. It wants us to do brain last. And the idea is it was originally developed for trauma. Its main idea is to try to help us work through our survival responses. So fight, flight, freeze, and fawn. And it wants to help us.
Fawn?
Yeah, some people call it fawn or flop.
I've never heard that. Okay.
Yeah, it's a lesser known one, but it's one that's sort of um not quite freeze, but also not quite flight. It's a little bit more of a play dead response rather than a freeze response.
Got it.
Yeah. And so the idea behind somatic experiencing is we want to try to complete whatever those responses were, so that if our brain feels they're complete, or our body feels they're complete, more accurately, we can achieve more integration and actually heal from the trauma.
And move.
Yeah. There's so many situations in life, in human life, where a trauma response might start, but for so many reasons it can't complete. We get stuck in one of the stages. And so Peter Levine, the person who developed this, got the inspiration behind watching animals in the wild that would go through traumatic experiences and be able to complete the response because they don't have any of the societal pressures, or
like I should lift myself up by my bootstraps, or
yeah.
I should not. That shouldn't bother me. It wouldn't bother somebody else. Or in our family, those things don't really matter. Or
Yeah. So it's very fascinating, and it's really, really flipping what a lot of therapists are used to doing on its head. And it's really trying to connect people with what is there, as you're telling the story, what is actually happening in your body. And then let's pause and let your body kind of do the work. Like, how can you there's a lot of movement involved, a lot of imagery involved, trying to, just help us.
Question. And I could be going in a completely different tangent. So
No, that's okay.
If I am. How does something like breath work differ from somatic experiencing?
Oh, it doesn't differ. It's fully part of it. It's very foundational.
Like holotropic breath work, that kind of, yes. Okay.
Yes. It's really, really going to be, breath work is 100% what you and the therapist would be paying attention to and really giving a lot of care for, and trying to even expand, getting all your senses involved in the breath work, and really noticing, okay, at what part of this is your breath catching? Okay, let's get curious about that, and things like that. So breath work is very integrated. So if you like breath work, you would like SE. Yes.
I would like SE, yeah.
Yeah.
I can see it being really helpful for people who are less verbal,
Yeah.
who are stuck with feeling but can't actually express it. I could see where that would be really helpful.
Yeah. It can also be helpful for even the opposite, for people that are really, really good at intellectualizing and telling their story, and people who feel
have
like
no connection to where it is in their body.
Yeah, people who feel like, I've told this a million times and I understand it and I get it, and yet I'm still running into all these blocks. It can be really helpful for that too.
Wow. Thank you.
Yeah.
Oh, anything last? What drives you? I'm going to ask you one last question before we close today. What drives you to continue doing this work, and that continues to excite you about this work?
That's a good question. I think just those moments of connection that I really get to have with people. whether it's when they're getting past a challenge or when they are coming up against a challenge and they keep coming back. And so
That
it's
bravery.
this,
That
yeah,
bravery. Yeah.
yeah, I feel, yeah. And that keeps me coming back because I say, okay, I want to meet that bravery and keep learning about all this stuff and keep finding ways to, really get people connected with the type of therapy that works for them. And once they have that, kind of just keep going along that journey. So I think it's just the connection.
Yeah, that makes sense to me. It
Yeah.
does. I can see that in you.
No,
So thank you, Rachel, for joining me today and for all the great work you're doing out there.
Oh yeah, thanks for having me. This was fun.
Good.
Thank you for joining this webinar. Tune in to more webinars and sign up for our newsletter at o'connorpg.com.